Hey, I'm Dr. DeLay. I'm a board certified urologist in South Carolina, and today I'm going to talk about PSA. Let's start with what is PSA. PSA stands for prostate specific antigen. It is a protein that is made by the prostate and involved in male reproduction. We measure this protein in the blood as a way of screening for prostate cancer. Any disease process that disrupts the prostate can cause an elevated PSA. This includes infections as well as enlargement of the prostate. As we age, our prostate gets bigger, and this causes many men to have a higher PSA as they become older. An additional reason is that we screen for prostate cancer using PSA, and an elevated PSA can be a sign of prostate cancer. Prostate cancer affects approximately 1 in 8 men during their lifetime. Unfortunately, it doesn't cause any symptoms until it would be incurable. Fortunately, however, we do have PSA as a screening test to find it while it is still curable. One problem with PSA is that there isn't a certain cutoff which is normal for all men. Once again, in general, the lower the PSA, the better, and the higher the PSA, the more it becomes concerning that the man may have prostate cancer. When I see a man for an evaluation of an elevated PSA, I use the PSA value along with his age, other health problems, family history to determine his risk of prostate cancer and the need for prostate cancer screening. There are a number of online calculators that we can use to estimate his risk of prostate cancer. Historically, most men with an elevated PSA would go on to get a prostate biopsy. Now, with MRI technology doing such a good job at detecting most prostate cancers, which are going to be significant, I often get an MRI before considering a prostate biopsy. This isn't always true, especially in men who have a very high PSA. Men become very anxious at the thought of a prostate biopsy, but it's important to remember this is a quick procedure which can be done in most urology offices with minimal discomfort. An ultrasound probe is introduced into the rectum where the urologist can visualize the prostate. The nerves running along the prostate are numbed up using lidocaine so that the man feels very little discomfort. After the biopsy, the urologist will usually have the results within 1 to 2 weeks and can determine the next steps based on the result of that biopsy.